Hello and welcome. Today we're diving into a fascinating and complex condition called Fanconi syndrome. This isn't your typical urinary tract infection. It's a rare disorder that affects the kidney's ability to properly reabsorb essential substances back into the bloodstream. In essence, vital nutrients, electrolytes, and other molecules are lost in the urine, leading to a cascade of potential health problems. Join us as we unravel the mysteries of Fanconi syndrome, exploring its causes, effects, and management strategies. So, what triggers Fanconi syndrome? The causes are diverse and can be broadly categorized as inherited or acquired. Inherited forms are often due to genetic mutations affecting the proteins responsible for kidney tubule function. Specific genes like CELC2A2, which is important for glucose transport, have been linked to the disease. These mutations can be passed down through families. Acquired Fanconi syndrome, on the other hand, develops later in life and can be triggered by several factors. Exposure to certain toxins like heavy metals as lead, cadmium, certain medications like outdated tetracycline, chemotherapeutic agents, or even certain industrial chemicals can damage the kidney tubules. Certain diseases like multiple myeloma, cystinosis, and Wilson's disease can also lead to acquired Fanconi syndrome. Now, let's understand the underlying mechanisms of Fanconi syndrome. Normally, the kidneys filter blood and reabsorb essential substances, glucose, amino acids, phosphate, bicarbonate, potassium, and even water back into the bloodstream through the proximal tubules. In Fanconi syndrome, these proximal tubules malfunction. They fail to properly reabsorb these vital components. Think of it like a broken recycling system. Instead of returning these important materials to the body, they are lost in the urine. This loss of bicarbonate leads to metabolic acidosis. The loss of phosphate leads to bone abnormalities. Loss of potassium can lead to muscle weakness and heart problems. Loss of glucose leads to glycosuria, and loss of amino acids leads to aminoaciduria. The entire process disrupts the body's delicate balance, leading to a host of complications. Pinpointing the exact prevalence of Fanconi syndrome is challenging because it's quite rare and often underdiagnosed. However, we do know that inherited forms are typically diagnosed in childhood, while acquired forms can occur at any age, depending on the exposure or underlying condition. Cystinosis, a specific genetic disorder, is a significant cause of Fanconi syndrome, especially in children. While Fanconi syndrome itself is rare, the prevalence of conditions that can lead to acquired Fanconi syndrome, such as certain cancers or exposure to specific toxins, can influence its occurrence. The signs and symptoms of Fanconi syndrome can be wide, ranging and vary depending on the severity of the condition. In children, failure to thrive, poor growth, and bone deformities as rickets or osteomalacia are common. This is due to phosphate loss, which negatively impact bone health. Muscle weakness, fatigue, and excessive thirst and urination, polyuria and polydipsia, can occur due to electrolyte imbalances. Bone pain and fractures can be more frequent. Acidosis can lead to nausea, vomiting, lethargy. Dehydration is also a significant risk. In adults, similar symptoms may appear, but bone pain and fractures may be more prominent. Because of the diverse array of symptoms, Fanconi syndrome can often be misdiagnosed. Diagnosing Fanconi syndrome involves a combination of clinical evaluation and laboratory testing. A urine analysis is crucial to identify the hallmark signs: glucosuria despite normal blood glucose levels, aminoaciduria, phosphaturia, excess phosphate in urine, and bicarbonate wasting. Blood tests are also essential to assess electrolyte levels, kidney function, and acid-base balance, including measuring serum bicarbonate to assess for metabolic acidosis. Additional tests may be needed to identify the underlying cause, such as genetic testing for inherited forms or specific tests to detect toxins or underlying diseases. A bone X-ray can also show signs of rickets or osteomalacia. While Fanconi syndrome doesn't have distinct types in the traditional sense, it's helpful to categorize it based on its underlying cause: inherited versus acquired. The inherited forms are further classified based on the specific gene mutation responsible. For example, Fanconi anemia, a completely different and much more severe disorder, involves bone marrow failure in addition to Fanconi syndrome. Acquired Fanconi syndrome is categorized by the specific cause, such as toxin-induced, drug-induced, or disease-related. Managing Fanconi syndrome focuses on addressing the specific deficiencies and complications. Electrolyte imbalances are corrected with supplements such as phosphate, potassium, and bicarbonate. Vitamin D supplementation is crucial for bone health. Addressing the underlying cause is essential. This may involve removing the offending toxin or treating the underlying disease. In severe cases, dialysis or kidney transplantation may be necessary. Regular monitoring of kidney function, electrolyte levels, and bone health is also crucial. Nutritional support is also important, focusing on ensuring adequate calorie and protein intake. Preventing inherited Fanconi syndrome is, unfortunately, not currently possible since it is caused by gene mutation. Genetic counseling is recommended for families with a history of the disorder. Prevention of acquired Fanconi syndrome focuses on minimizing exposure to known toxins and avoiding unnecessary medications known to damage the kidneys. Careful monitoring of patients receiving nephrotoxic drugs is essential. Early detection and treatment of underlying diseases can also help prevent the development of acquired Fanconi syndrome. The prognosis for individuals with Fanconi syndrome varies depending on the underlying cause, severity of the condition, and the effectiveness of treatment. Early diagnosis and management are crucial for improving outcomes. Inherited forms tend to have a more challenging prognosis, especially if kidney failure develops. Acquired forms may be reversible if the underlying cause is identified and addressed promptly. Research is ongoing to identify new genetic mutations associated with inherited Fanconi syndrome and to develop more effective treatments for kidney damage. Gene therapy is a promising area of research for inherited forms. Advances in dialysis and kidney transplantation have also improved the long-term outlook for individuals with severe kidney failure. We hope this video has been helpful. Thank you for watching.